My name's Jess Foster. I'm a salaried GP working at the Old School Surgery in Fish Ponds. I grew up in a household with both my parents being GPs, and I guess grew up with them being extremely positive about their job, which I'm sure influenced me a lot. And then I guess in medical school, I generally found lots of things interesting and could never really see myself working in a hospital environment, and always liked the idea of working in the community. So a typical day would involve getting into the practice about 8 o'clock, and then the morning would be a mixture of different types of consultations, so some face-to-face, some telephone, and then we have a really nice clinical meeting every afternoon where we all get together and discuss patients or any questions that we have about management, and then we'd do some home visits and have a similar setup in the afternoon. So the Old School Surgery is quite a big practice and has been expanding recently with about 20,000 patients. And it's a large team, so lots of allied healthcare professionals. It's got 6 partners and just gone up to 10 salaried doctors. There's also 2 clinical pharmacists, a mental health practitioner, and it makes for a really exciting place to work. We've also got a student base where we look after the students from the University of West England, UE, which also adds in another aspect to the patients that we care for. So in terms of training and development on offer in Bristol, there's the aspects that are available within your GP surgery. So you might have a mentoring scheme like the one that we have at the Old School Surgery, where you have a doctor who you meet up with on a regular basis. And there's also things available on a Bristol-wide basis, such as the Health Learning Partnership that offer GP teaching sessions that you can join. And there's also options for newly qualified GPs, such as those run at the Spa in the Nuffield. And also there's a GP First, which is for people who are in the first 5 years post-qualifying. To be successful as a GP, having a good level of curiosity is really important, and wanting to know more about a patient's life other than their blood test results, and being really flexible and wanting to be part of a team, and also, I guess, being able to deal with uncertainty and having a good degree of enthusiasm for the job. I think one of the most rewarding things about being a GP is developing that continuity of care with your patients and being there with them throughout their illnesses and their health. And that enables you also to be their advocate and sometimes communicating between different teams for their benefit. I think patients would say that they really enjoy being part of the Old School Surgery. I think they'd say we're a really friendly practice and that we provide a really good continuity of care. I would recommend working in general practice for the huge variety of medical problems that you see, and also for the sustained relationships that you have with patients over many years, and also because of the huge joy you get from working in such a diverse team. I would recommend living and working in Bristol because it's a really vibrant, multicultural city. It's a really great size. It's got lots going on, but it's not so big. And it has really easy access to the countryside, so to Devon and Cornwall, Wales, and it's a really friendly place to live too. So I think the moments when you really realise why you wanted to be a GP and why you love it so much, it can often be shown when dealing with palliative care patients, in particular when you help them and their families make everything as easy as it can be at the end of life, and when you sit down and have difficult discussions with people and then help them to die in the most peaceful way possible, and then supporting the families after. And I think when you get a letter that comes through or a card a few weeks down the line to say thank you for caring for our relative, it really makes everything worthwhile.